Meaningful Medicine is a Novant Health podcast, bringing you access to leading doctors who answer questions they wish you would ask. From routine care to rare conditions, our physicians offer tips to navigate medical decisions and build a healthier future. Today, we're focusing on contraception options with Dr. Dorothy Parsley, an OBGYN with Novant Health. Dr. Parsley, thank you for being here today to provide an overview of all these options we have today. Let's start with oral contraceptives, which have been around for many years. What are the two main types?
So you're absolutely right. Oral contraceptives still are one of our most commonly used birth control methods. And when we're thinking about the different oral contraceptive options, we have both combination pills, which contain estrogen and a progestin. And then we also have progestin only contraceptive pills.
How do patients know which one may be best for them?
That decision is usually based on if there are any other, goals from a contraceptive use standpoint, whether cycle control is a consideration, and certainly other medical conditions. We know that estrogen can sometimes increase risks, mainly thrombotic risk. So we definitely like to avoid those in certain medical conditions. And sometimes it interacts with other patient medications. So sometimes a progestin only method, whether that's a pill or other, is recommended based on, medical conditions and other family history factors.
Can you share how the patch works and why some women may prefer this option?
Sure. So the contraceptive patch is a combination product. So just like our combination pills has estrogen and a progestin, the difference is frequency of use. So while a pill is used daily, the patch is changed once weekly. So very similar to a pill in that most women cycle once a month. But instead of having to remember to do something daily, has the benefit that it just needs to be changed once weekly.
What about the ring? That confuses me. How that works.
Yes, I think you're referring to the NuvaRing. So NuvaRing, similar to the patch, is also a combination product, so has estrogen and progestin. And it is a ring that's flexible, that's worn and inserted into the vagina by the patient. And that is changed once monthly. So also has the benefit of something that doesn't have to be remembered on a daily basis and can be worn, continuously for a month. And women usually also have kind of a once monthly menstrual cycle with that.
A longer term option is to get a birth control implant, I understand. So how long do those typically last?
So the implant in the arm, the Nexplanon device, that is currently approved to use for up to 3 years. The Nexplanon is a progestin-only method. So again, very safe for most women if current medical history or family history is a concern or a consideration. That is a progestin-only option.
So does that involve surgery?
So the Nexplanon is placed quite easily in the upper arm using just local anesthesia like lidocaine. And so we typically place these here in the office with a normal visit.
And then, not to be naive, but do you have to have it taken out or does it run out or how does that work?
Yeah, great question. So at the 3 year mark, or whenever a woman wants to have that removed, it's removed very similarly. We use local lidocaine anesthesia to numb the upper arm, make a very small incision once numb, and it should come right out very easily because it's placed just very superficially under the skin. Also done for most women in the office.
That is amazing. These are a lot of options. It's got to be kind of hard to choose one. Can you explain the different IUD options?
Yes, of course. So there are also progestin only IUDs, and then we, of course, have a non hormonal IUD. So the progestin IUDs, there are several: Kyleena, Mirena, Liletta, which there are some like the Kyleena that's effective for contraceptive up to 5 years. And then Mirena up to 8 years for contraception. They have a very similar progestin, just a little different in size, so have a little different dose that determines their length of efficacy, so to speak. And then the non-hormonal IUD Paragard is actually a copper IUD. And that is effective for birth control up to 10 years.
Wow, a decade. I can't even imagine. Don't even
Yes,
have to worry about it. Wow. So maybe that's a good option for younger women.
absolutely. Or the nice benefit that there is absolutely no hormone. So, for women who want to avoid hormones or need to avoid hormones for medical conditions, it is a great option.
That's a good point. Well, Dr. Parsley, some women may also choose to have a tubal ligation procedure, also called getting your tubes tied. Can you talk about how this procedure is performed and the recovery time?
Absolutely. So, getting tubes tied most commonly is done as a laparoscopic procedure. So, yes, that's done in the operating room under anesthesia with a small camera that's inserted into the abdomen. And there are a lot of different ways that the tubes can be tied, so to speak. So, rings can be placed on the fallopian tubes, or clips, or a small portion removed. And a lot have been moving to removing the entire fallopian tube, salpingectomy. But recovery, nonetheless, is all very similar. Most women are back to their normal activities and day to day routine within 1, sometimes up to 2 weeks. So, usually very well tolerated with a short recovery period.
Well, we've gone over a number of options. What advice do you give patients on navigating all these options and choosing what's right for them?
Considering contraception is very individualized, and women usually have different goals, right? Whether that is it just solely birth control? Are we talking about controlling a cycle? There are other many, many benefits to our birth control options, sometimes improving skin quality or mood. And so a lot of the determination is based on some of these other goals, and also what makes sense for each person and what are their medical conditions. So many considerations when it comes to choosing a contraceptive, and always so important to talk to your physician or your provider about what options might make most sense to each person.
You brought up skin conditions, and it brought me back to um, many decades ago when some friends said, "Oh, I'm just on birth control for my acne." And I thought, really? So that is a thing? Because
It
a lot of us
is
said, uh-huh.
It is a thing. And often it is not uncommon to get a patient in at the recommendation of their dermatologist to try a contraceptive pill to help with hormonally driven acne. Yes.
Wow. I understand hormonal birth control options can carry some side effects. If they're troubling, do patients have success switching to another medication or type of contraception to lessen side effects?
Yeah, absolutely. And there are a number of side effects, no doubt, that can be associated with each option. While most are well tolerated, certainly if women have unwanted side effects, or certainly an issue with their contraceptive, I usually find that we are successful in getting a different contraceptive, whether it's a different pill formulation or a different method altogether, based on the specific side effect that the woman is experiencing. So yes, usually able to find something that is a better fit.
Well, we've covered a lot of ground today, and you've given us a lot to think about. Thank you so much. Is there anything else on this topic that's important to keep in mind?
I think it's important that women share with their physician or their provider, what is important to them when choosing a contraceptive, and sharing goals and what is the goal with using contraception, whether that is birth control or other, and partner with their provider to come up with the best plan.
And just to wrap it up, Dr. Parsley, I'd love to know how this specialty became a passion of yours. What drew you to obstetrics and gynecology?
Yeah, taking care of women at all aspects of their life, from adolescence through childbearing years and menopause, has been very stimulating for me. And I'm amazed at what our bodies can do. And it has been just such a rewarding field of medicine. And I'm happy to take care of women every single day.
And they're lucky to have you because clearly you're very passionate and skilled at what you do. So thank you again for sharing your expertise. We really appreciate it.
Thank you so much.
Again, that's Dr. Dorothy Parsley. To find out more, please visit nh.team/women's health. And to find a physician, visit novanthealth.org. For more health and wellness information from our experts, visit healthyheadlines.org. Thank you for listening.